In health news, Rick Eding, father of 6, was on the heart transplant list until his weight exceeded the criteria to receive a new one. Dr. Jon Schram and his patient are here to tell us why this happened and how bariatric surgery, actually the first of its kind in Michigan, put Rick right back on that list. Thank you so much for being here, both of you guys.
Thanks for having us.
Absolutely. So we want to go back, Rick, actually to when you were actually diagnosed with that heart condition, and of course what this meant for you by needing this condition, or this heart fix for you.
It was real tough to get the diagnosis that would need a transplant and even the LVAD. Just real difficult.
Let's go back to when your condition actually started. Was it back in 2000 is when everything started for you?
In 2000 I had an allergic reaction to an antibiotic and went into cardiac arrest. Okay. And battled it till 2006, actually went into heart failure and kind of started to spiral down until 2011. Ended up with the LVAD. Okay.
So I guess that's what landed him in your care, correct? How were you able to help him, or what did you have to do?
Yeah, well, actually, we were approached last year by the advanced heart failure team at Spectrum at Meyer Heart, and they had Rick and a couple of other patients who have these LVAD devices in place. They're ventricular assist device that help the heart work when the heart's in failure. And the problem was that now he had the device in his heart. Heart was working well, but the weight was such that they couldn't ultimately do the transplant. So they came to us in the bariatric program and said, what can you do to help us, you know, with these patients who are at high risk, and can you help us get them to the point where we could get transplant?
Right. And so at that point, too, I mean, you're a very young man, right?
Yeah, I'm only 40 and have a few kids at home.
A few, yes. Yeah. We have a picture of your family. I think we want to go ahead and put the picture up of your family. 6 kids that you help take care of, which of course is a very demanding job for you, right?
Yeah.
So I guess you got put back on the list, and from that point on, what has this done for you?
You know, I've dropped 50 pounds since October 21.
Wow.
And back on the list, just waiting for the call, and hopefully can lose another 50, maybe 60 pounds over the next 8-9 months, and ultimately get the heart and be able to keep the weight off after transplant.
Is your weight something that you've always struggled with your whole life?
I've never been tiny, and it has more or less gone up significantly since all of the heart failure and just not being able to be active and being able to exercise.
Right. And let's dive a little bit more into the details of what it is that you guys had to do, kind of more in layman's terms, but I think it's really important for people to realize what it is that you were able to do to help get him back on that list.
Yeah, so when we do bariatric surgery, we're operating on the stomach. And you know, a very safe operation nowadays, but now we were trying to do this operation on a patient who's got you know, a heart ejection fraction of about 20% of what somebody would normally have. And this device that's being utilized to pump his heart actually sits right in the lower part of his chest, kind of right where we do the operation. So, and because he's got a device in his chest that pumps blood, he's got an anticoagulations. So there's some significant risks involved, but we worked with the cardiac anesthesia group at Meyer Heart and with the cardiologist at Meyer Heart, and we came up with a plan that we thought we could do safely, and fortunately it worked out really well, and Rick's done real well. But it's a little bit of a trickier operation to do an operation like what we do on patients who have significant heart failure.
Right. And as we mentioned, this was the first of its kind in Michigan?
This was the first one in Michigan.
Was that nerve-wracking to you? How did you feel about that?
At that point, I would do anything to get a new heart, and this is just a stepping stone. Right. And not only when I get a heart, it'll help me to keep my weight down after, as well as all of the meds that kind of people tend to gain weight after transplant.
What is the outlook at this point, and any idea of when all this could happen?
I'm just waiting for the phone to ring.
And then it's go time, right?
Yeah.
Will you be involved with that process at all, as far
No, we
as
don't-
working with him because of the bariatric
No,
situation?
we'll be cheering him on.
To be cheering him on. And sometimes that's all you need in a
That's what we need to
situation
do,
like
right.
that.
Yeah.
All right, well, thank you so much for sharing the story. And obviously, his is kind of a unique case, but if people are interested in learning more about bariatric surgery and how you can help them, what is the process of getting in touch
Rick's
with
actually
you?
the first. We've done another one since
Oh,
Rick
you have?
of an LVAD patient, and we've got about 6 or 7 people on the list. So,
Wow.
yeah, there's a need for it. So,
Okay,
we're
well,
happy to
best
help.
of luck to you. I can't wait to have you come back on and tell us how your procedure went.
Definitely.
All right, thanks so much for stopping
Thanks,
by.
Thank you.
Absolutely. All right, and to learn more about Spectrum Health Medical Group Bariatrics free surgical weight loss seminars, you can go ahead and call them. The number's right there on your screen, or register online at shmg.org bariatrics, and you can go to Grand Rapids and Reed City. The number is 616-267-7400, Zealand 616-994-6677. So a lot of information there, but we'll make sure to put this on fox17morningmix.com so you can get all the details.